Good afternoon, everyone, and welcome to our COVID update for today. It is another beautiful spring day here, and I know being outside gives me lots of reasons for positivity and optimism and hope that not just weather-wise spring is here, but that we're starting to see some real progress and a real thawing and signs of good things to come. So that is good. I will say we are definitely in the midst of a real, as I see it, race to make sure that we can get enough people vaccinated as quickly as possible before we potentially see COVID numbers go up again, before we could see almost some version of a third wave, which I hesitate to even say, but which is definitely a possibility with the numbers right now. So I'm going to talk through the numbers and talk through where we are with vaccines. But at the top, I just want to really urge everyone that at this critical moment, we need to work together to get everybody vaccinated, and we need to work together to continue to keep COVID in check in that meantime and buy ourselves some time. And that really means masks and distancing and hand washing and avoiding those social gatherings with folks without those precautions. So diving in by the numbers, total cases in the county now over 13,000 cumulatively since the beginning of the pandemic at 13,008. Approaching 318,000 tests administered, 10,862 recovered, and unfortunately one more fatality since our last update last week, bringing our total to 243 Ulster County residents lost to COVID. Just in the last 24 hours, New York State surpassed another grim milestone of 50,000 New Yorkers across the state lost to COVID, making us the second worst state in the country. So we have a lot more work to do again before we can see that number come down to zero, and we are doing that work. Hospitalizations are leveling down a little bit, which is good news. We're at 9 currently hospitalized in Ulster County beds, one of them in an ICU bed, and we're still holding steady at or around or a little bit under 10 hospitalized, as opposed to the peak back in the winter where we were over 35 hospitalized. Active cases, though, continue to be real cause for concern, and it strikes you visually here on the graph of active cases that you can see the beginning of, we had a leveling off for the last 2 weeks or so, and now the possible beginning of an upsurge in active cases. We're at 1,903. That's pretty close to the levels we were at right around the Thanksgiving and Christmas surge. So if we can't level that back down, we could really see that continue to accelerate upwards right at the time that we know vaccines are becoming more available. The new positive rate is still hovering right around that 5 to 6%. In the last 96 hours in Ulster County, we were at 5.42% for a 4-day average over that period. That's nearly 6,000 people tested, 5,962 tested, which is one of our highest in a while, and 323 positives out of that just shy of 6,000 tested. Once again, putting us at 5.42% new positive rate, much, much too high. And as long as that number stays high, the active case count will be high, the hospitalizations will follow, and unfortunately, the fatalities will follow. So it all starts with us at the individual and group level, following the precautions, even if you've been vaccinated, following those precautions to keep COVID spread in check. Hospital capacity, we are and have been in good shape here for quite a while, and you can see that in the numbers, not concerned here at this point. And once again, just to really hammer it home, coming into another holiday weekend with Easter, please continue to follow the precautions that we know work in terms of masks, distancing and avoiding gatherings, and hand washing. I know it's a pain and has become very old at this point, but it works. And many of you probably saw, I believe it was yesterday or perhaps the day before, CDC, the new CDC director, actually become emotional talking about her worries and fears about potential reemergence of COVID right at the time that vaccines are really finally coming to scale, thanks to everybody's hard work, and how concerned she was about that. And we share that same concern. Dr. Smith, was on here last week with me, sharing that same concern. With the increase of variants, bringing our numbers up, we have to actually up our game and re-up our vigilance, not even just going back to things we were doing before, but really even being even more cautious, because these new variants are more contagious, and we have to act appropriately and respond appropriately. Shifting to vaccines, lots of good positive news here, so that is nice to have and nice to see. Yesterday, a major positive and significant development for the county and the state. New York State has now significantly expanded eligibility. So actually effective today, all adults, regardless of any other criteria, over 30 and up, age 30 and up, can begin now to schedule appointments. That is a dramatic expansion of eligibility effective today across New York State. And then next week on April 6th, the remaining set of folks age 16 and up can also begin to schedule appointments and get vaccinated. So in the next week, we will reach a point far ahead of the Biden administration's guidance of May 1st. Across New York State, we'll reach this point now where there's universal eligibility for everyone over the age of or 16 and up. And so that puts the onus now back on us running the distribution effort, which we are ready for and ready to step up to do to get a lot more people vaccinated. So we'll talk about those numbers in a minute, but I definitely want to thank the state for expanding this. Many of us have been urging this as we started to see supply pick up. And now, thanks to this increased eligibility, we've got lots of work to do to get the remaining basically 2/3 of our residents that are still not vaccinated to get them vaccinated. So how are we going to do that? This week, Ulster County, among our county health department and our other partners, has been allocated quite a high number of doses, 6,770. That's the second most of any week that we've received. We got a few more than that a few weeks ago, but this is continuing to show major progress with nearly 7,000 vaccines for us, plus the fact that we now have the state-run site operating at the Ulster County Fairgrounds. They're doing around 1,000 doses per day, 7 days a week. So that's another roughly 7,000 doses to put into the mix. So that means that in Ulster County this week alone, our residents will have access to just shy of 14,000 doses. And that's another major set of progress that we can make here with supply picking up. So thank you to everybody that's been a part of that and is doing that work. We'll be running our same county-led vaccination site at the Hudson Valley Mall at the former Best Buy site. That's now been up and running for a little over a week. That's been going very, very well. On average, we're doing usually more than 2,000 doses a day there, doing it quickly, safely, equitably. So I want to thank everybody that's working at that site and volunteering at that site. In addition, we're adding each week, as we hoped and promised, more and more partners into the mix. You can see this week a growing list of not only hospital and pharmacy partners, but now we're finally getting more of our medical doctors and practices, especially our smaller and medium-sized practices in the area, added in. So excited to see those different practices get added into the mix, including my own doctor's practice is on the list this week, so that's nice to see. And that means more and more opportunities and options for all of our residents across the county, whether they go to their doctor, to their local pharmacy, to the CVS or the Walgreens, as well as hospitals and finally our county site. We are also, as we get more Johnson & Johnson, still working to do our homebound vaccine program. We're still not getting as much J&J as we'd like to do that, but we're continuing to push on the state to allocate that to us, and as soon as we're getting it, we are ready to ramp up our homebound delivery program. By the numbers, you can now see each day significant progress in terms of vaccinations within Ulster County. Currently, at least as of this morning, we have vaccinated now 33.6% of our population, and the exact number is 59,948 who have at least gotten their first vaccine dose. Realistically, probably by now, we have surpassed that 60,000 people mark, given that we've been doing vaccines throughout the day. So that is another major milestone, to have over 60,000 people, most of whom have just really been in the last few weeks, get vaccinated. And that's exactly that steep exponential curve that we'd like to see go up, is our vaccination numbers. So again, I'm really proud and thankful to our collective team working on this across the county. As we expand eligibility, I really want to ask everybody's help to spread the word among everybody you know, to make sure that they have access to this additional supply of vaccines. So I want to ask your all's help. If you're watching, please share out our sign-up link, which is vaccinateulster.com. Even if you've already been vaccinated and if you're already signed up on our pre-registration list, please share that link with a few friends who may not be vaccinated themselves, or who could also share with more of their friends. We really need to use the power of our community to mobilize, to look out for each other and inform each other and take care of each other. So please help spread the word on social media, by phone and text and email, and you can go, if you want to safely knock on your neighbor's doors, and if you have a few minutes, say, hey, have you been vaccinated? If not, you can go to vaccinateulster.com. That'll put you on our pre-registration list, and that means every day that we have available appointments, you'll get an email right to your inbox, and you can just schedule right from there, or you can get a phone call if you'd prefer. If you're not able to sign up online, you can give us a call at 845-443-8888. That's 443-8888, and that'll let you sign up and pre-register via phone. Finally, if you want to go above and beyond, and you've already been vaccinated and you want to help even more, we definitely will continue to need more folks to work at our county vaccination site. Much of the workforce, as many of you know, as I've talked about, is powered by folks who are volunteering and doing that public service. We have, in the last week, started offering a stipend to compensate folks for that work, and make sure that, especially in a time like this, folks are able to be paid for that work. So please, even if you're able to do one shift, go to ulstercountyny.gov/volunteer, the link right on the screen, and sign up for a shift. And we'll take it from there. And we have been seeing a lot more people volunteering, so to those out there doing that, we appreciate it. I bumped into somebody today at lunch who said they're going to sign up, so thank you to them in advance. It really is a positive experience to go work at our pod site and see thousands of people getting this life-saving vaccine and just feeling that relief and that positivity. And really, it's kind of I read an email the other week, and it stuck with me. Someone said it's just kind of a place of love, and I know we all feel like we could very much use that right now after the last year plus. So on that note, today is a pretty quick update. Thank you for tuning in, continuing to be engaged. Please spread the word about vaccines and spread the word about continuing to follow the precautions until we can get everybody vaccinated and get to herd immunity. That's really, really important. A special thank you to all of our frontline workers who are out there, especially if you're in this category. Please make sure you get signed up to get your vaccine if you have not already. That'll keep you safe. It'll keep all of us safe and your loved ones. But again, a special thank you to all of you. Our next update will be Thursday afternoon at 3 o'clock. In the meantime, anything you need, you can call our Recovery Service Center at that number that I mentioned before, 443-8888, whether that's vaccines or COVID or other critical needs, food and shelter, and really any other help that you might need. Please reach out, and we'll continue to be here for you. I hope you enjoyed this beautiful day. Hope the weather continues to be nice like this for everybody's sake. And we will see you in about 48 hours. Stay safe and healthy and be resilient. And have a good afternoon.